Hello, everybody! Time for the world famous Renewable English intro. Hi there, everybody. How are you? How are you doing? How are things? I have completely forgotten to put the capture on below. So let's see if I can find that now and see if that's going to work. I'm not sure if it will, but I'm not going to spend too long working through that one there. Hi there, Inaya. I hope you're well. Thank you so much for joining us. Absolute pleasure to see you. Thanks to everybody who's come along to join us. Today, we are going to be looking a little further into the SDGs. We're up to number 3 today, and we'll talk about that very, very soon. First of all, please check out the website. There's all sorts of goodies on there. Subscribe to the YouTube channel. One day I'll get used to using the opposite hand. Today is not that day. And of course, give us a follow all over the social media. We're on Twitter as well. I just haven't updated that one yet. This would have been bad to use the other night, I guess, when we had the outage. And of course, feel free to email or speak to us at any point that you desire. So, our quote this week: the power of community to create health is far greater than any physician, clinic, or hospital. What do we think they mean by that? What do we think they mean by that one? I'll tell you what I think they mean. I'll tell you what, when Dr. Mark Hyman's speaking here, I think he's talking about everybody around us can really help create good health, but not just free from infirmity. Good health, as in good well-being, good mental health, can create a great nature around ourselves. And yet, when you have a sense of community, when you have people around you supporting you, you always feel an awful lot better. Hi there, Marcin. Nice of you to join us today. We're just talking about this here quote. Now, I am going to look at... Oh, I've got all the definitions in there already. That made it a bit easy, didn't it? Got rid of them nice and quickly. So, health. When people think about health, people automatically assume it means about being sick or not being sick. But the World Health Organization talk about health as being a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Hi there, Svetlana. Thank you so much for coming along today. So, health. Are you healthy? Well, maybe you wake up every morning, your back doesn't hurt, you don't feel sick, but you really don't want to go to school and you're a bit worried about something at school, or you don't want to go to work. Well, you're maybe not completely healthy, because there's a lot of the mental health and the mental well-being that is incredibly important. Now, your well-being is a state of being happy, healthy, or prosperous. Now, I'm not sure about the prosperous part of that. I think well-being is about taking care of yourself in here, and in here. I find meditation and yoga are incredibly useful when thinking about well-being and being mindful. Being mindful, something I've spoken to a lot with Vanessa, a good friend of mine. I spoke on Teachers Talk Radio about being mindful, enjoying nature, being at one with nature, being at peace, not being on this forever. You know, this can really drive you a bit crazy. Hi there, nice of you to join us. Giorge G. And Anna, lovely to see you. As always, the wonderful Anna is here. Thank you so much for joining us again. And communicable and non-communicable diseases. Communicable. With two M's, I actually think. I probably made a mistake there. These are the diseases or illnesses that can be passed. Hi there, Sergei. Thanks for joining us. Communicable diseases are things like COVID that can be passed from one person to another, but the diseases are usually more grey. They're more, things that can be passed from one person to another. A non-communicable disease is something that cannot be passed from one to another. Maybe it's hereditary, something more like cancer or having a stroke or something like that. So I would just like to give you a bit of a warning that today the SDG is all about good health and well-being, as you can see here. It's a really, really, really difficult subject to talk about. It is not pleasant. Good health and well-being is, how people are feeling, their health, their physical health, but also their mental health. Now, I've got a long explanation here of the 9 different goals that they have at the UN for the Sustainable Development Goals. Hi there, Ritik. Lovely of you to join us, mate. Always a pleasure. There are a lot of these different goals. I'm not going to go through each one, but a lot of it talks about dramatically reducing mortality or early mortality or preventable mortality. So a lot of it is about death. Now, one thing I think the UN have really, really dropped the ball on here. They've really made a mistake. To drop the ball is when you make an error that could easily be avoided. They call it good health and well-being, and they mention it's all about that it has mental health in there as well. But if you look closely at the goals I just showed you before, and if you look closely at these, reduce maternal mortality, reduce preventable deaths in children, end epidemics like AIDS, tuberculosis, malaria, neglected tropical diseases, reduce by 1/3 non-communicable diseases, prevention and treatment of substance abuse, halve road traffic accidents, ensure universal access to sexual and reproductive health care, achieve universal health coverage, reduce deaths from chemicals and pollution. Not one of those mentions mental health. Now, number 5, of course, prevention and treatment of substance abuse is very, very closely linked to mental health. But it's something that's so important, and with the pandemic recently, so many people have been left in a state of uncertainty with things being more difficult. Something that really upsets me is there is only one mention of mental health and well-being in all 9 of these goals, and that's in 3.4, and it says here, reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and promote mental health and well-being. Now, I'm sorry, everybody at the UN. Now, I'm going to get a bit angry now. My apologies, everybody. I'm usually very positive with these lessons. I'm very sorry, everybody at the UN, but this is not good enough. This is not good enough in any way, shape, or form. The mention of mental health in this is an afterthought. This is not the first and foremost in any of these. It's kind of dropped in at the bottom there. I've just put in the chat box the worksheet if you want it. It's not something that's focused on, and it really should have its own special focus. If you've got time to look at road deaths and road accidents, then you've got time to look at mental health and look at its connection to substance abuse and so on and so forth. But anyway, that's enough of me ranting and getting angry. There are some flaws in the Sustainable Development Goals, but in general, they are a good place to start. So, tobacco control, access to vaccines, medicine, health, financing and infrastructure, and pandemic preparedness. Now, These were written in 2015. To be prepared for a pandemic. 6 years ago. So they were thinking about this kind of thing 6 years ago that could have happened. Were we prepared for a pandemic? How many people here in the chat think we were fully prepared for a pandemic? Feel free to say yes, no, maybe, could be, not particularly, I don't really think so. I think very strongly we were not prepared. So these goals were written 6 years ago, and we clearly were not prepared for a pandemic. And let's see if we are prepared for another one in the future, or if there is the immediate panic again and locking everybody at home. Which here in Spain, my daughter, who was 7 at the time, there, Marcin, very nice. Lots of no's there from Marcin. My daughter was 7 at the time, 6, in fact. She was 6 and she was told, all children across the country were told to stay at home. They were not allowed to leave the house, not for exercise, not for anything, for 52 days. 52 days locked inside a house. Now, that is not good for anybody's health. That is not good for anybody's mental well-being. That is just bad all around. That is bad preparedness for a pandemic. This is not the way to deal with it. And you have to consider as well, here in Spain, there are lots of flats, so people could not even have any outside space. My daughter's lucky that we have a garden. But yeah, this preparedness was absolutely not there. We were nowhere near it, not even close. So there we go, that's the SDG 3 that we're going to be talking about. I've got some really super exciting news to share with you at the end of the lesson, so please do stick around. I'm ridiculously excited to share this news with you. I've got 2 bits of good news from this week that I am so excited about. But before that, let's take a look at some unfun facts. Now don't you worry, he was away last week, but he's back this week. It's our good friend, Unfun Frank.
Hello everybody, it's Unfun Frank here, and I'm back from my lovely trip to Dudley with my Unfun Facts, with my new shirt, my new tie and my new hat. So the first Unfun Fact is that they're not very fun, these Unfun Facts. That 7.2 million people a year pass away due to tobacco-related illnesses. The next one is quite a strange fact, because I certainly don't ever touch a drop. The total volume of alcohol consumed per year has increased by 70% in the last 30 years or so. Now, this one's quite a crazy one, that 73% of road traffic deaths occur amongst young males. Probably because they're more careless drivers, I imagine. And in 2016, 91% of the world's population was living with poor air conditions, according to the World Health Organization. So, that's it for Unfun Facts. Let's see if you can get the questions right now.
There we go. That was Unfun Frank. I wasn't ready for him at the end, you could see. So let's have a look to see if it's true or if it's false. The first one. Less alcohol is drunk now compared to 30 years ago. Yeah, they were super unfun this week, weren't they, Anna? Like, usually they're quite unfun, but this week they were like mega unfun. Trying to bring this SDG to life and bring it a positive note, it was quite difficult, I have to say. So what do you think? Is there less alcohol drunk now compared to 30 years ago? Is that true or is that false? True or false? True or false? False. Exactly, what is alcohol? I don't know. So we're talking beer, wine, vodka, whiskey. It is absolutely false. There is a lot more drunk now than before. Next one. Du-du-du-du-du-dun. Young men are most likely to get into a car accident. Young men are less likely to get into a car accident. Are most likely, sorry, to get into a car accident. Absolutely right, Aisha. They are most likely. I think we'll find that young men tend to be overconfident when they're driving in general. I'm not going to say all young men. Certainly from what I've seen on the roads, I cannot emphasize enough how dangerously young men tend to drive. So any young men out there watching and getting ready to learn how to drive, please be a bit considerate, not just for other people, but also for your own sake. And the last one here, the vast majority, now vast means a lot. So the vast majority, most people, but really, really most people, live with poor air quality. The vast majority. It is true, Inaya. Apparently, 91% of people live with worse air quality than the standard for the WHO standard, the World Health Organization. Certainly because of pollution. Absolutely. Like the overconsumption that we're using now, and the stuff that's being pumped out, everybody driving everywhere. I even noticed today, I live in a very small village, and walking home from school, the number of cars shooting past. I lived about 20 minutes walk from my daughter's school, and we walk past people, and every 5 minutes we get closer, we see more people getting into their car or getting out of their car from school, and you just think, can't you just maybe walk, take your bike, something? It's not a dangerous place to walk, I have to say. So, next up, we're going to move quite swiftly. Wow, we're really racing through the class today. I was very lucky this week to speak to a doctor, an infectious diseases doctor from the UK. I actually went to university with him. He was my housemate. I call him Dr. Josh. His name is Josh, obviously. Josh Parsons. Josh Parsons. Very good there. Our Supreme Court had to warn our state government strictly last year over this issue. Well, I hope they've taken heed of the warning, Ritik. I really do. So I spoke to Josh Parsons, somebody whose name I should know, as I've known him for about, 15 years. Very good friend of mine. He is an infectious diseases doctor, and he works in the United States now. So I'm going to go through the questions, what we're going to talk about. Again, these are all on the worksheet. If you would like, I will drop it back in the chat box. It's there in the materials. Get back over here. What is SDG 3, the Sustainable Development Goal number 3? What types of diseases does Josh work with? I've already told you that. What does Josh say is a good way to stop your friends getting sick? Then, if you are ill, what should you do? And the last one, coming from a doctor, ladies and gentlemen, coming from a doctor, a trained medical professional, not somebody who's on Facebook talking about their freedom. Oh, I don't want to wear a mask, it's my freedom. Well, guess what, mate? I don't want to wear trousers and underpants in public, but it's not just about you. I don't think people want to see me walking around naked, do they? So what I do to protect people's eyes, I wear trousers and underpants. So what you could do to protect people's lungs from this horrible disease that's going around is maybe just put a mask on. It's not that bad. It's not that difficult, and it's quite a nice thing to do to not infect people. I heard this week that in schools in the UK. What was it? 1 in 40 people had time off because of either infection or being close to somebody with infection from COVID, which is up from 1 in 80 in the first week of September. This has a lot to do with vaccines and not wearing masks. It's not that hard. Just put a mask on. Not that difficult. Anyway, stop ranting, Harry. It's time for the interview. Interview time! Welcome back to Renewable English interview time, and it's interview number 3. Nearly said 4 then. This is SDG 3, and it's all about good health and well-being. So today's guest is a good friend of mine and a fantastic doctor. It's Josh Parsons, MD, PhD. Would you like to say something about yourself, Josh?
Yeah, absolutely. Hey, Harry, thanks for having me today. I'm an internal medicine, infectious diseases doctor working at a large academic center in the US. I'm happy to be here. Thanks for having me.
Amazing. So I'm going to ask you a few questions then, all about health, all about what we can do to improve our health and what we can do to improve other people's health as well. So the first question, now this was actually sent in by one of our listeners, no, one of our students. Get it right, Harry. Okay, so the first question is, what can we do to promote good health with our friends?
So yeah, as you mentioned, there's several ways we can do this. The most easy way is not get your friends sick. So wash your hands, soap and water, or alcohol, so hand sanitizer with at least 6% alcohol. You don't have to do it compulsively, just do it intermittently. Also, if you're, regardless of coronavirus times, if you're sick, stay at home. If you have to go out, wear a mask. Another thing you can do that doesn't revolve around infectious diseases is get active. Go work out with your friends, challenge each other, take up new hobbies. Just really be active. Fourth thing is you can cook together, cook healthily. If you have some recipes that you want your friends to try it out. Yeah, my 4 quick tips.
Amazing. I really like what you said there. If you're ill, stay at home. Now, I think this is something we can transmit to adults as well. Like, I don't understand that when those people go into work and they're like, oh, I've got the flu, I feel terrible.
Yeah.
Well, stay at home, please.
Yeah. I mean, especially in the US, there's a culture of never calling in sick. Calling in sick a week, but really, when you end up infecting your friends, your co-workers, and they have to take time off, they give it to their children, you give it to their elderly relatives, you end up causing much more harm than good. So, and while the thing I mentioned about masking, as well as the evidence about wearing masks to prevent catching diseases is a little bit iffy. We have so much evidence showing putting masks on people to prevent respiratory illnesses is really effective. So if you really have to go out to the grocery store and get something while you're sick and coughing, just wear a big mask. So it's so easy.
So there we go. Thank you very much for your time today, Josh. It's been an absolute pleasure catching up with you.
Yeah, you too.
And I'll speak to you soon.
Speak to you soon, mate. Bye. Bye.
Bye. So there we go. There you have it, right from the doctor's mouth. Wear a mask. Not that hard. So SDG 3, what is it, everybody? If you do want to see the full interview with Josh, it is up on the YouTube channel, which is probably where you are right now, unless you're streaming through the amazing, wonderful, incredible website, renewableenglish.com. So what is SDG 3? What is SDG 3? What is it? Put it in the chat box. Put it in the chat box. If you don't want to put it in the chat box, you can write it on your worksheet. You can send it in later. If you're watching on catch up, feel free to write your answers in the comments. Whatever you like. Good is good health and well-being, Anna. 5 points to Anna. And also, you get this post-it note. and a tattoo drawn on by my daughter. Number 2, what types of diseases does Josh work with? What types of diseases does Josh work with? He works with a type of diseases. We talked about them at the start, but we gave them a different name. Infectious diseases, very good. Infectious diseases. Communicable diseases as well is another thing that you can talk about. What does Josh say is a good way to stop your friends getting sick? Now, he had a few of these. What way does he say? What does Josh say is a good way to stop your friends getting sick, yo? What does Josh say is a good way to stop your friends getting sick, yo? What does Josh say is a good way? Very good. Infectious diseases, Rittik. Well done. Number 3. What does Josh say is a good way to stop your friends getting sick? Oh, wow. I should definitely be a singer in some kind of band. Good. Wash your hands. Wash your hands is a very good way. And yeah, don't expose them to illness. Wash your hands properly. Wear a mask, good. Sanitize your hands, very good. So the next one, I think a lot of us have kind of answered the next question as well. If you're ill, what should you do? If you're ill, what should you do? I think somebody's already answered this previously, but stay at home. Please stay at home. I think there have been a few positives, very few, but a few positives to come out of this pandemic. And one of those is when people feel sick now, they have to stay at home in case they have the virus. So it's encourage people that when they don't feel right, to stay at home. It's just what you should do anyway. Like, seriously, I really used to get so angry with people when I worked in a school for quite a long time, and teachers would come in and they'd be walking in and their face would be blue and they're full of smug up. I feel terrible. I can't do anything. Stay at home if you're sick. You've clearly got the flu. I don't want the flu. The children don't want the flu. It is better to wash your hands. You are absolutely correct. Very, very good. You are correct. Sanitize if you have to, though. Yeah, if you're ill, stay at home. And the next one, why is it good to wear masks? Why is it good to wear masks? There are many good reasons to wear masks. Many, 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 many. Is it for you? Are you wearing a mask for you? Are you going to think this mask is going to protect me? I'm going to be great. I'm going to be wonderful. It's going to save me from everything. Wearing a mask, it's not just for you, is it? It's more for everybody else. It's more for other people around you. If you jump in the car and you're very, very drunk and you start driving, that's not only bad for you, it's also bad for everybody around you. So here we go, guys. Chuck on a mask. Very good. Exactly, Anna. It does prevent you from getting it, but it also prevents other people and it helps us stay away from catching diseases. Another great thing, when we live in a place with terrible air pollution, we don't breathe in as much grime as well. So what I've noticed is another aspect of this. I haven't had a cold for a very long time. I haven't picked up any of these non-COVID illnesses for a couple of years now. Now I'm lucky, I do have quite a good immune system, which has built up over the years, but yeah. So great work on that, really good, some amazing answers. We're going to go for Ali's top tips now. Feel free to note them down and think of any of your own as well. I had real fun making these top tips. And as I said, if you want to see Josh's interview, check it out. There's also talk of the link between mental health and physical health. It's a really great interview. So here we go with Ali's top tips.
Hi, and welcome to Ali's Top Tips. Put your phone down and do some exercise. Donate to charities like Red Cross and UNICEF. Don't be afraid to ask for help, and don't be shy to give it. Eat fruit and not with a snack. Sleep a lot. Sleeping's awesome. Thanks for watching. Bye.
So there was Ali with her top tips. She'll be back next week with more. If you do have any top tips, feel free to drop them down there in the comments section below. Also, do share them with us on Instagram. You can find us on Insta. Share them there. Hashtag Ali's Top Tips or hashtag Renewable English. Of course, always give us a tag, give us a follow as well. We share information, we share stuff throughout the week. And next week, we're going to be bringing in a new vocabulary function as well. Follow us on YouTube. Check us out on, don't want to hide that beautiful face. Check us out on the website. And of course, if anybody would like to give us something for a coffee, this is completely free. This is for you, it's for you, for your students. If you are the students, this is for you to help you. I do believe that education should be free. Education should be available to everybody who needs it. The next lesson is actually about quality education. So yeah, please do feel free to donate. Every little really does help. We have all sorts of subscriptions and all sorts of things that we need to take care of. But don't worry, we're going to keep coming at you free of charge forever. So, I told you there was some exciting information. I've got 3 things I want to tell you, if you want to stick around for that. Number 1, now I'm really excited to talk about this. I just got, the other day, if you follow me on Instagram, you'll know this already. I just got solar power on my house. I'm currently consuming 37% of what I'm producing from the sun, and you can see there it's 31 degrees here. It's October, guys. Why is it 31 degrees? The next bit of information. Now, I don't know if this is good or bad news, but we are probably going to go down to 1 lesson every 2 weeks, because at the moment I am writing a book and I'm creating a teacher's training course, and I'm going to be speaking at a few conferences, and I want to make sure these classes are top quality. I don't want to rush them. I don't want them to be something that isn't useful to you, that isn't useful to everybody. So there's some news that is going to probably go over a couple of weeks. And the last bit of news, now this is super exciting for me. I am a very, very, very proud person right now. I don't know if you've ever seen this. Kids Against Plastic. They are the world's greatest charity. They are run by 2 incredible young human beings making a massive difference to the planet. I've been a huge fan of them for quite a long time now, working very hard with them to try and create a better place, to empower young people to make a difference to the planet. Well, some super exciting news for me anyway, and hopefully for everybody at CAP. I was asked to be a trustee for Kids Against Plastic. I was asked to be a trustee for Kids Against Plastic. Now, I don't want to stand up and scream and run around like a small child, but I am so excited about this new role. To be able to try and influence and help move Kids Against Plastic forward with some of the incredible things that are coming up, with COP coming up, with the TEDx talk coming up. There are so many things that Kids Against Plastic can do and will do. I'm just so excited and honoured to be part of the team. I cannot express my thanks to Amy and Ella and Tim and all of the other trustees for trusting me to be a trustee. I'm not often lost for words, but when they asked me, I was lost for words. So I'm just absolutely over the moon. This is great news for me, hopefully great news for CAP. We can keep them moving forward. So yeah, brilliant news all round, I think. Solar power, so Renewable English is finally using renewable energy. We're moving forward with CAP, and that is about that. You guys have been absolutely amazing today. I've had such a great, fantastic lesson today. I was really worried and nervous at the start of this class because it's so intricate and deep and a bit kind of depressing, but you guys have made it amazing. Remember, take care of yourselves, take care of other people, take care of your physical health, but also your mental health. Remember, if you need a break, take a break. Thank you so much for being here with me. Don't forget to give us a follow and a subscribe. And I will hopefully, I think next week is going to be the last one that we do weekly. After that, it will be every 2 weeks. So I'll be back next week. I can't wait to see you. Thank you very much, everybody. Here's the outro. I'll let you enjoy it.